So this is a little instructional guide on chest tube removal. So the first thing I'm going to do when I walk into a patient room is I'm going to, number one, assess them and make sure they're ready to get the chest tube taken out. I'm going to check the chamber of the chest tube for an air leak. If there is no air leak, I'm going to simply take the chest tube out. So first thing I'm going to do here then is take off the current dressing that is in place. And I'm going to clean the site prior to putting a new dressing on. So I'm going to take ChloraPrep, and I always warn the patient that it's going to be a little cold and it might sting, but it's simply cleaning the skin. So do kind of like a circular motion around the chest tube and on the chest tube itself. Then I'm going to take a scissor and I'm going to cut the suture holding the chest tube in place. And I usually try to pull the chest tube out a little bit just to make sure I'm not going to have problems pulling the chest tube when it's time to. I'm going to let the ChloraPrep dry on the skin. And then I'm going to put new tape on. And I just do the top and the middle so that the chest tube can easily slide out. And then usually at this point I will have the patient practice taking a deep breath in and holding their breath, just to ensure we're on the same page. So I'll run them through it. I'll show them one time exactly what I'm looking for and then have them practice. So I will tell the patient to, at my count of 3, I'm going to have them take a big breath in and hold their breath. When they're holding their breath, I'm going to quickly pull the chest tube out. It's fast, it's like a blink of an eye, and then I will apply the dressing and I will tell them to breathe again. So if I'm doing this on a patient, I'm literally going to hold pressure at the site, and I'm going to say 1, 2, 3, take a big breath in and hold it. As they're holding the breath, I'm going to quickly pull the chest tube out, and I'm going to put the last piece of tape on. And I'm going to ensure that there is a nice tight seal around the chest tube, around that site, to ensure that there is no air getting into the space. Another, the Vaseline gauze that we put on initially with the gauze is also another mechanism we use to kind of prevent any air from going into that space as well. When I'm done with this, I'm going to make sure the patient's hemodynamics are within normal limits. I'm going to check their lungs bilaterally to make sure that they have bilateral breath sounds, and then I will tell the nurses to make sure that they monitor the patient closely for at least 15 minutes up to an hour, just to make sure that they don't have any signs of increased pain, pneumothorax, sub-Q emphysema, and if anything should arise, then I will get a stat chest x-ray. Otherwise, I would typically just get a chest x-ray tomorrow morning. That completes this. Thank you.